Hello, my name is Erickson, and today I will be doing Alzheimer's disease. Alzheimer's disease is a progressive and degenerative disease. It is the most common form of dementia and usually affects the elders mostly. As of today, the disease is incurable, so there's no cure for it at this moment, but it causes problems in speech, memory, and the ability to perform motor skills. Along with that, the disease also causes mental and functional losses, which affects the individual memory. Usually, the end result of the disease is death. As the disease progresses, it eventually leads to death. And after the age of 80, usually the incidence, the people who get the disease, number of people who get the disease per year increases as the person gets older. As far as the causes for Alzheimer's disease, at this moment it's unknown, and according to research, it has been shown to have a genetic component linked to it. There seems to be an abnormality in chromosome 21 for those individuals who have Alzheimer's disease. In addition to that, head trauma like falls, automobile accidents seems to be linked to the disease as well. As far as the characteristics for the disease go, there seems to be amyloid plaques and neurofibrillary tangles shown in the brain when they do a type of brain scan like magnetic resonance imaging. Who is affected? Usually the elders are affected, and a perfect example of this is my grandmother. Usually, when I tell her stuff, she usually forgets stuff pretty quick. So in that case, her short-term memory is affected the most. As far as now, 5.3 million Americans have Alzheimer's disease, and by the year 2050, it is suspected that 1 million new cases will develop. Signs and symptoms, usually the short-term memory is affected the most. The person has an inability to concentrate and inability to learn new information. So just imagine an individual coming to a PTA program with Alzheimer's disease. I think it would be pretty hard for the person to go to the PTA program because we're constantly learning new information. As the disease progresses, language breakdown takes place and the patient does not recognize their relatives. And I believe that's the point when the individual gets institutionalized, because for some people, they institutionalize their relatives because they don't recognize them, but for others, they might feel empathy and might just keep their relatives at home. 5 to 10 years after diagnosis, that's when the physical activity begins to decline. So the person is not able to dress and do ADLs. Also, along with the signs and symptoms, sleep disturbances takes place. So the person might experience insomnia and other sleep problems. How is PT involved? We usually, as PT, we try to improve motor skills, and according to research study, physical activity seems to help those patients improve their cognitive ability, especially those individuals who are experiencing some type of dementia, like as we know, Alzheimer's disease is a kind of dementia. According to studies, those individuals who are usually engaged in any type of physical activity, such as running, it could be weight-bearing exercises, usually increase their cognitive ability, and they gain the ability to walk, and they become more independent. Their ADLs increase, they're able to dress by themselves, and so forth. As I mentioned earlier, weight-bearing exercise be used as a treatment for patients who have Alzheimer's disease. It could help delay the progression of the disease, how the disease progressing in the individual, and keep the individual independence. Treatment, at this moment, there's no actual cure for the disease, but they usually sometimes use cholinesterase inhibitors, which are FDA approved. They seem to be safe, and they seem to slow down the disease progression. And as far as PT and PTA goes, we usually try to control, minimize the symptoms of the disease, and try to provide the patient with education as well as the patient relatives. with proper techniques on how to get from a wheelchair to a bed and from that to a wheelchair. Physical therapists, we usually try to help the patient walk. We usually try to, by teaching the patient or helping the patient walk to help the patient stay in their home for a longer period of time. We usually teach the patient and relatives about proper techniques, like, as I mentioned earlier, getting from a wheelchair to a bed. Physical therapist techniques. We use verbal cues, like telling the patient is walking, oh, look straight, be careful, keep your eyes, look ahead. We usually use tactile cue when we touch the patient to give the patient directions. We also use mirroring. Like, for example, we want the patient to raise our right arm, we will raise our left arm, and usually try to break down tasks into smaller pieces so it could be easier for the patient to understand. As far as visual cue goes, which is another technique that we use, if we want the patient to stand up, we might raise both arms, we like, please stand up, and that's an example of a visual technique that we use with patients. Prognosis. Drug therapy seems to delay the disease progression, and usually patients try to maintain, we as PT, we try to maintain patient cognitive ability for as long as possible. We once again enable them to stay in their house. And as PT and PTAs, we have a duty to make sure the treatment, which is basically, the treatment is developed, the PT developed the treatment and we basically follow it. We try to make sure that the treatment works, but do no harm to patient and most people promote good. And this is a diagram of a normal person who has Alzheimer's disease. This is a normal person brain, and this is a patient who has Alzheimer's disease. As we see, the cerebral cortex is normal size in the normal brain, and the hippocampus seems normal. And here we see the ventricles, which are normal size. And now we take a look at here. The ventricle seems enlarged in an individual with Alzheimer's disease. The hippocampus is actually smaller, and the cerebral cortex seems smaller as well. Any questions? You have any questions?
I do.